Hey everyone, Christy Kapp here, founder of DIYPracticeManagement.com. I want to share with you the first 4 things I look at when I come into a doctor's office or any kind of dental office as a consultant. And there are 4 things that you should be looking at constantly so that you know where the low-hanging fruit is or just where to get back on course, because we all have months that are bad months, and it's just human nature. It's not about blaming or shaming anyone. It's just about paying attention to making sure you're still on course. So number 1, doctor production. I evaluate the doctor production based on how many team members they have, how many operatories they have. Obviously, I'm going to benchmark a doctor differently if they only have 1 op and 1 assistant compared to a doctor that has 3 restorative ops and 3 assistants. Somewhere around $20,000 to $25,000 a month, at least per op, for doctor production. Number 2, I'm going to look at hygiene production. Same thing. If a hygienist has 2 ops and an assistant, I'm going to benchmark him or her based on that compared to a hygienist with no assistant and only 1 op. But the thing that I look at really the most to benchmark a hygienist is, are they producing 3 to 4 times in gross production what they make per hour? For instance, if they're making $50 an hour, are they producing $150 to $200 an hour in gross production? And I say gross production because there's so many different PPO plans out there, and different offices have different percentage of write-offs. If you're a high PPO practice and write off 25 to 30%, that's really high. But I would make sure that the hygienist is doing at least 4 times her salary in gross production per hour or per day. Number 3, unscheduled treatment. That's a quick report I pull, or hopefully you have a dashboard that's an easy number to keep an eye on. Unscheduled treatment tells me a lot of things. It tells me how good is case presentation? Does the team know how to close? Do they present a lot of treatment and everybody walks out the door and don't know how to talk about the benefits and risks of getting the dentistry done or not getting it done? So I look at unscheduled treatment number. I've seen anywhere from $150,000 of unscheduled treatment over millions. So it can be anywhere, and that's one thing I like to look at immediately. And then number 4, new patient flow. New patients solve a lot of problems. And so I look at that first. If the flow isn't very good, like 25 or less per doctor in the office, then that's something we might not want to look at. I'll look at marketing, internal and external. See ways we can improve that if needed. But those are the top 4 things I look at very first when I go to consult an office. Take a look at those yourself, benchmark yourself, and see where you can be improved. Low-hanging fruit is easy to grab and grasp onto and focus on for the next month or the end of the year. Have a good day. This is Christy Kapp. Be sure and opt in for emails and updates on DIYPracticeManagement.com and become your own practice management expert.